Today we have a guy that covers all 3 points of our physical health formula in natural dentistry evolution. Allan Spiegel of Palm Harbor, Florida, the MD, he's been doing this for over 15 years. He's had hyperbaric oxygen. He's got 6 hard chambers. These chambers are the epitome of getting oxygen into the body. It's a forced way to get oxygen into the body, but many bodies that are down and out require that. Correct oxygen supply affects every cell, every mitochondrial portion of our cell, and every portion of our body. And so when I look at my formula saying that physical health equals structure plus nutrition minus toxicity, I can see in every facet of that trio that the oxygen matters. And that's why we think Allan's important. So I invite you to hear what Allan has to say about his skill set in neurology or hyperbaric oxygen.
I'm Dr. Allan Spiegel. I'm a neurologist practicing neurology for nearly 30 years. The field of neurology is a branch of medicine that deals with injuries and pathology, as well as function of the brain, spinal cord, nerves, muscles, and how they integrate with one another. I think I'm among maybe 2 or 3 totally United States that actually integrates hyperbaric therapy into a neurological practice. Hyperbaric therapy is a treatment that's been available for nearly 100 years. I consider it among the best kept secrets of medicine. Hyperbaric therapy is a treatment where a patient is lying on a stretcher, enclosed in clear glass, breathing 100% medical grade oxygen. You and I are currently breathing 21% oxygen, but we're giving 100% oxygen. And then we increase the pressure slowly. You know, when you go up in an airplane, you feel the pressure in your ears, and you equalize the pressure between your ears and your environment by pinching your nose, swallowing, and ears pop, as they say, and the rest of the flight is fine. Well, you're in a pressurized cabin when you're in an airplane, but you feel perfectly comfortable. It's identically the same sensation. So when you're breathing 100% oxygen under pressure, you increase the amount of oxygen that saturates and perfuses every part of the body: bones, skin, brain, spinal fluid, blood, anywhere from 10 to 15 times more oxygen than is normally present. Now, what does oxygen, when you're breathing it at that concentration, do to the body? Number one, it causes new blood vessels to grow into any part of the body where there's not getting adequate blood perfusion. Number two, it reduces swelling and inflammation. Number three, it makes your white blood cells, white blood cells that gobble up dead tissue, that attacks bacteria, any foreign bodies. It makes the white blood cells work much better. It also helps lay down the framework for healing. That's why it's used so much these days for wound care. It improves the immune system. It even enhances the amount of natural stem cell release that occurs every day in your body. There's a certain amount of natural stem cells we all have. And hyperbaric therapy has been shown to increase the amount of dispersal of the stem cells 8 times more than those who are not receiving hyperbaric therapy. You know, the benefit from hyperbaric therapy is not the air around the body that is exposed to the 100% oxygen. It's how the oxygen gets into the body and gets dispersed through the body. Let me explain something. You know, some people think that hyperbaric therapy, oxygen therapy, is you get oxygen absorbed through the skin on its own, and you do to some extent. But the value of hyperbaric therapy is you're breathing the oxygen, goes into the lungs, goes into the blood. Now, in grade school, we're taught that you need those little hemoglobin molecules to grab onto the oxygen and carry it across into different parts of the body, different organs. And then it releases the oxygen to the organs, and it goes around again to the lungs and picks up some more oxygen and keeps going around in a circle. That's true, but we are supersaturating the body so that far more oxygen is not just in the hemoglobin or in the blood itself, but in the serum, the fluid that bathes the blood cells. So that is super saturated with oxygen. What benefits you get stay. You don't have to come back for repeated treatments to maintain it. Of course, if you have another injury to that area, I mean, that's another story. But I've had patients who've had stroke, could not move an arm and leg, came for block of treatment, got better, and that's it. Okay, which is important to understand, because it's not that in order to keep it from regressing, you have to do more therapy. That's not the case. But if you don't do at least 20, you may not get the benefit that you would have otherwise had. One in which I've been very interested in is a lot of the brain injury, post-traumatic stress and traumatic brain injury that we're seeing in a lot of the soldiers coming back from Iraq and Afghanistan. I personally have seen a lot of patients with traumatic brain injury from the IED blasts and other blast injuries, and frequently come in with cognitive issues, memory problems, headaches, inability to sleep at night, agitated. The government, in their wisdom, has decided to utilize medications such as antidepressants, anti-anxiety medications, and other preparations such as that to treat the soldiers. And there's a large number of these soldiers, unfortunately, that commit suicide. Okay, very high percentage. Matter of fact, more soldiers have committed suicide in the United States if coming back from Iraq and Afghanistan than actually died in the field. We have found that using hyperbaric oxygen therapy, we get a much, much better response. And it's amazing, the first day they come in, they have what we call flat affect. They're emotionless, and they're almost zombie looking in that regard. And they answer the questions. They're usually slow in answering the questions. They have to stop and think a lot before they answer those questions. And by the end of the week, which we normally do hyperbaric therapy 5 days a week, by the 5th day, when they're coming in, so they only had 4 treatments. By the time they come in the morning on the 5th day, you look at them and almost unanimously you see something on their face you didn't see before, and that's a smile. And then you look at them and say, what happened? You go, I don't know. And they start smiling for the first time. The family members say, he's not smiled since he came back from Vietnam, from Iraq. And then as time goes on, their sleep improves, headache is reduced, their nightmares and reliving a lot of the battles they had been in subside. I had a soldier that I treated that when his wife would drive him from one place to another, he'd be looking in all the strip centers, looking to see if there's anyone who has a gun or a weapon that's going to aim at the car while they're back in the United States. Also, these soldiers have a tendency to sleep with guns or knives underneath their mattress because they feel in the middle of the night they may have to go up and protect the family. Those all subside. I've had soldiers that came back from Iraq and Afghanistan who could not hold a job, who were on drugs and alcohol, who completed the program, which for them is between 40 and 60 treatments, and they've gone back to school. Some have just completed a college education. Some went on for a PhD. They're holding jobs now. They have a family, have an apartment on their own. They're not living on someone's floor, and they're doing the American dream. Okay, a job, family, children, dog. Okay, and a job. Okay, and that is the most fascinating. And it's without the pharmaceuticals. There's a sheriff of Pasco County just north of us, who went to Fallujah, Iraq in 2005, and he went because I think some other police officers from Pasco County went, so he went to join with a group. And in his first 6 months, 8 months he was there, an IED blast took out the front third of his brain. So both frontal lobes and half of both temporal lobes were blown away, and obviously he survived due to the good care that he got in the field, and subsequent when he got to the hospitals in Germany and the United States. He did survive, and but they were treating him from 2005 to 2010, and during this period of time he had no movement at all of the left arm and leg and could only speak a handful of words. I was contacted by a physician and who told me the story about how he was injured and asked if I could help, and I said sure, send him over. We treated him. Within the first week his speech improved significantly. By the end of the first month he started moving the arm and leg that he couldn't. By the end of the second month he was moving enough that we could barely get him up to a standing position. So in other words, he was 5 years wheelchair, never stood. We got him to stand, albeit with me, my technician, and his mother. This guy's like 6'6" and he's like 280 pounds. Okay, big guy. We held him up so he could stand. By the end of the next month, he was walking with a walker, and the month after that, he was walking with a cane. And today, he has full strength of the arm and leg. Speech is phenomenal. Memory is intact, and he doesn't even use a cane. We have videos of him getting on his horse, riding it. We have videos of him going into the stall where his horse is and shoveling the manure out of the stall. And he's, I mean, I'm not going to say he's 100%, but a man who for 5 years never got out of a wheelchair, who is now able to function, it's pretty dramatic. The reason why it seems the hyperbaric seems to work for brain injury, and particularly in this case, this soldier with brain injury. Hyperbaric therapy causes new blood vessels to grow into any part of the body that's not getting adequately perfused with blood and nutrition. Now, conventionally, every day in the hospitals across the United States, there's 14,000 treatments done using hyperbaric therapy. Most of the time it's for wound care, however. Now, a reason why a wound develops is because you have an area that gets either traumatized or there's poor circulation to the area, and since there's poor nutrition to the area because of poor circulation and inflammation, you wind up not getting adequate perfusion of nutrition to lay down the framework for healing and let the wound heal itself. Now, I take that example and I say, well, hold a second. A stroke or brain injury is a trauma and is a wound. So what's the difference between the two? I mean, you have a wound in the leg, which you say we know heals well with hyperbaric. Why not the brain? And I equate the fact that people who've had a stroke have had a blood vessel that went to a part of the brain, got closed off, either from a blood clot or a calcified plaque, or even a ruptured blood vessel where the blood just leaks out of the blood vessel itself and causes pressure on the normal brain structures. Well, it's the same phenomenon where you get increased blood perfusion to the parts of the brain that survived. There's part of the brain, when you have a stroke, there's a central area of dead tissue. Now, we're not resurrecting the dead, okay? However, there's an area around that tissue that's called the penumbra, which is sleeping, dormant, idle brain cells. And in other words, in order for that to survive, it must be getting some nutrition through capillaries or through other means into that tissue, just to let it stay alive, although not enough to make it function. So with hyperbaric therapy, you're getting new blood vessels to grow into that area, to give it perfusion, to give it nutrition, to carry away the waste products of metabolism, the toxins that are in that area that cannot be pulled away because it's not a vascular system to pull away the toxins. It makes the area heal and give nutrition to those areas that are still alive. And if those areas do have a function, if it's a functional part, such as the motor function of the body, or the sensory function, or the speech function, or the balance function, or the visual function, if it has a function, you can bring a good deal of those functions back. And that's why it works for this gentleman. There was some inherent pathways that were not totally destroyed. And as well as when I see stroke patients, we have had many do exceedingly well with hyperbaric as well.